And one final note, this is our presentation to him. It is hand-carved, Bodop wood pen.
Okay. Thank you so much. With a thank you for that very, very kind introduction, and for all of you for putting this effort together. And in light of the recent disaster, I had many phone calls back and forth to my office. Hey, is it okay to show up here? Are we going to be all right? And they said, well, it's like Southern California, Northern California. So with all the circumstances, I am extremely pleased to be here. And I hope not on myself, but what is really happening for all of you, for all of your children, and bluntly, an ulterior motive to all this, can we start an effort to make this change? Growing up back west in California, we always had the image somewhere that the East was your academic institutions, although I would certainly say we made our debates with UCLA, Berkeley, and Stanford. The Midwest was kind of the Midwest, and the South was the South. I will say very openly, as I've worked with children around this country, that I actually have more success with the schools, the teachers, the educators in the Midwest and the South, where you guys are more open, you're listening, and I think you're starting to look at problems in a very polite way. I hope this could be the South rising again, because I'd like to see all of you lead a battle that we win this for the children. Now, what's going on out there? Nobody is debating anymore, although a few academic people will say we need to study this, but the truth is the incidence of autism has increased immensely. We have a 10-fold increase in this country at minimum. United Kingdom reports increases, and as I will bring up later, this becomes impossible to think of in the old ideas of autism anymore. And yet, you just had horrendous disaster in the southern part of the state, Louisiana. I hope before I'm done, you may understand, we have more children out there, a minimum, a couple 100,000, more realistically 400, 500,000, maybe 1 million. And if the world can understand, if this country can understand, these are not write-off children. These are not give up on them, they can't be helped. Then the truth is, we're in the middle of a bigger disaster than nature's ever created. And I would lead to the fact, who's looking ahead, just like the issue of the levees in Louisiana? What's society going to do if we have anywhere from 1 to 160, 1 to 150 adults eventually requiring social care? One of my patients made a prediction, and I don't think he's far off, that if we don't change this, in somewhere between 10 to 15 years, depending upon who you believe, 1 out of 4 males born would be autistic. I bluntly said we're not going to ever have that happen because we can't get there. We can't support it. Society would collapse. So hopefully what I'm going to present is a way that we maybe can change this. Now, people say I grew up in a fantasy world at times. I still believe there's a lot of good people out there, and I still believe that if the right message gets out there, this can be made to change. So many people asked me, what's my definition of autism? I think what is up on the screen there is as appropriate as any old ideas of autism. We have a word that has destroyed your life, resembling sci-fi, the comic books when I was a kid, faster than all efforts at science and logic, able to paralyze parents and professionals with the sheer thought, able to leap over all logic, skepticism, past established clinical medical principles and policies with a single expression. Now the good news, I'll also tell you there's going to be kryptonite here. Disguised as autism, Mercury, toxicity, put a whole bunch of labels in there, ASD, PDD, CDC, childhood disintegrative disorder. I have never heard anything like that in my life as a pediatrician. But now that is being used on children out there, and we're literally watching children just kind of fall apart. So this word has fought very hard against truth. It wants to stay away from scientific logic and reasoning. Justice, it is the last thing your children are getting. And somewhere, again, I grew up with the ideal of the American way. A chance for an optimistic future in life, a chance for equal education, equality, improved health care, quality of life for children and families. When I get done with this, I'd like to hope that on a very serious basis, there's a way we can counter this and turn to the issues that will change it. Now, the way to change it, the kryptonite, is the truth. Most parents, most educators, most professionals out there are so blinded by the A word that they have forgotten basic science 101. An epidemic cannot be due to a developmental or genetic disorder. For the record, there are absolutely no exceptions to that. One must have a disease process at work. If all we did was get the people involved in this, and I mean the scientists, the researchers, to go back to this, you would have an entirely different focus on your children. And as I will try to explain this morning, in the end, the only possible cause for this has become immune or viral in origin. Now, I'm standing up here, I'm going to do a presentation, I'm going to try to hopefully have you walk out of here understanding about your children differently, and what makes what I say different. I would say one, and I will try to show you this, there'll be some medical support. There's objective findings. Over the last 20 plus years of medical research, we've seen new diseases, new dysfunctions emerging, an entirely new understanding of what we call a neuroimmune axis. I graduated UCLA, which on the West Coast is considered a pretty good medical school. I am thankful to this day for the exposure to scientists, to professors that I respect to this day, and yet none of this was taught to me in medical school. This whole concept of neuroimmune has evolved over the last 20 years, and it's probably what has created the problem because most researchers out there, most investigators are not yet familiar with it. There have been multiple changes, increases in autoimmune diseases, multiple changes, increase in cognitive dysfunction. Medical science and routinely the lay press out there talk about a significant increase in environmental immune diseases in mammals. Well, again, somewhere in basic science, I was taught children are mammals. Now, to understand this, I'm going to take you all back a little bit, because to understand the confusion, what I believe right now are the mistakes being made, you have to go back and realize where the medical world's coming from, what, again, we were all taught many years ago. The truth is, we could look at the brain, but it was essentially a black box. Dating myself, we had already passed an era of doing CAT scans into MRIs, but nothing resembling functional MRIs, NeuroSPECT, early days of PET scans. We have techniques out there that now let us look at the brain in ways we never have, and yet some of those techniques are only now being started with your children. When you look at the brain, and I want to bring you back to this many times, because again, if we're going to win, it's going to be based on science and logic. I was taught if there is something wrong with an individual relating to their brain, you can have some kind of structural defect, you can have some type of congenital developed malformation, you can have a vascular malformation, you can have injury, you can have neoplasm or tumor. None of your children have those, thankfully. You can have a metabolic disorder, but I will say openly, there is no medical disorder in the medical literature that supports what's happening to your children on a metabolic basis. So finally, you're left with infections can invade the brain, and we know that herpes viruses like to go to the temporal lobe. That was taught to me many, many years ago. And we've learned an entire new area of immunology which, like I said, ties into the whole idea of neuroimmune. Now, again, to understand the changes, this all began changing in the early 80s. I could make the statement as a pediatrician that there was always a kid out there that we didn't quite know what was wrong with that kid, or something was off. But whatever those numbers were, they were so small, they really did not get any focus. Then suddenly, in the 80s, literally bursting on the scene, you had a new entity in adults. They were tired, they had cognitive dysfunction. Adults who were type A personalities, graduated college, could not remember where they were going. They would describe a foggy brain, and they had muscle, joint, endocrine symptoms. Around that same time, early 80s to mid 80s, you started seeing in the literature atypical ADD, quiet ADD, mixed ADD, ADHD with hyperactivity, ADHD without hyperactivity. What I would, again, respectfully say, we were taught in medical school, a child was a hyperactive, hyperkinetic child. They were considered bright, intelligent. The joke was, if you got them in their seats, they were bright. You just couldn't keep them in their seat. But now, as I will explain, you're looking at children in a whole different presentation, and yet, just like we're doing with the word autism, we have classified all them as ADHD. Hopefully what I would like to show you is it's time we brought these disorders back into the medical field. And starting again in the late 80s, going into the 90s, you had this explosion of autism. I would again respectfully say, look at the pattern. Adults, older kids, and then the younger kids. During the 90s, there's been a staggering increase in cognitive dysfunction, school difficulties in children, learning disorders, again, autism, PDD beginning to surface in large numbers. And I heard a Dr. Byron Hyde, he is a family practitioner in Canada, had at that point already spent about 20 years studying parts of this phenomena in adults, a little bit in children. And he made the statement at a conference I was at, that this was an emerging epidemic in children. School phobia, cognitive dysfunction, unexplained physical dysfunctions, expanding teenage drug addiction, teenage suicide. Now, when I will confess, as much as I was in this direction, believed in this, when I first heard him speak, I said, wait a minute, this guy's really out in left field somewhere. But you know what? It didn't take many years to understand he was right on track and right in the center of things. We have an epidemic affecting your children. And as I talk today, you can substitute the word autism, ADHD, LD. It's all going to eventually flow together. What you're looking at are children who have a medical problem and cognitive dysfunction and other medical issues with that. Now, again, when I was in medical school, I want to bring this because I hope that physicians that listen to this, that professionals will start to question, how are we evolving? What are we really doing out there? When I was trained in medical school, we were taught a child with that hyper ADD would very likely outgrow that by puberty. Now we're told that 50 to 70% of children have learning disorders, and this will continue into adolescence. The term ADHD is now routinely applied to adults and children. There are an increasing number of children with ADHD being called Tourette's. Now, I also will never forget a lecture, one of my first lectures in pharmacy in UCLA. We were told how paradoxically these hyperactive children would calm down on a stimulant medication, Ritalin, Dexedrine, and that you would never give those medications to a teenager or adult. Look what we're doing out there, and think about what we may be doing wrong. Within the past decade, investigators are writing routinely about weaknesses in higher order cognitive functioning, thinking, reasoning, school failure. They talk about children with metacognitive skills difficulty, unable to focus, passive learners. Again, I would respectfully say, these are not the children we were taught about in medical school 20, 25 years ago. Maybe they're not the same disorder. If you look at the developmental assessments coming in on these children, they will have what we call soft neurological signs: speech and language difficulties, deficits in cognitive conceptual thought, motor abnormalities and clumsiness. Again, how can we say this is all a developmental disorder in a child? Does not make sense anymore. What we are really looking at has become an explosion of autoimmune, immune-mediated disorders in adults and children. We now know diabetes is immune and viral mediated. Allergies, migraines, sinus infections have exploded in adults and children. One of my learning lessons as a clinician, I'm not sitting in a university doing research. I'm out there, in a sense, what they call the front lines. And when I first started in practice, I was able to make a very nice joke that if a mother looked at the birth certificate, she was not allowed to become ill until the child was 18. And all of you know, mothers cannot fall apart. Dads can, everyone else can, but you guys are supposed to hold it together. However, it became very obvious. I had mothers coming in with ear infections, sinus infections, migraines, things that they were supposed to have outgrown when they were kids. If you look out there, irritable bowel syndrome, Crohn's syndrome, ulcerative colitis, rheumatoid diseases, fibromyalgia, are all exploding, and these are all immune-mediated disorders. And we now know, which also in adults have exploded, Alzheimer's, Parkinson, MS, many other adult neurological disorders. Yes, there will be a Alzheimer's that is some type of a genetic disorder, but a lot of the increase in Alzheimer's is coming from an autoimmune process, and that means we can treat both children and adults differently. So now, what's happening? We have an enlarging group of children and adults. They do not fit classic disease profiles. Certainly, the origin seems linked to a neuroimmune dysregulatory phenomena, and while open for scientific investigation and discovery, whether we're talking some undiscovered retrovirus, the connection to viral factors has become unmistakable. Very likely, you will be looking at genetics, but not genetics like a genetic disorder that you're going to find a chromosome or a gene that causes what's happening in your children. Again, it gets kind of frustrating with respect to the professionals in the audience. I have to question how, after spending millions and millions and millions of dollars not finding a gene or chromosome answer, maybe we need to start looking somewhere else. I have no doubt that in the end, what we are going to see will be some type of a genetic, let's say, disposition. You may be linked to intelligence, to IQ, but that's not the same as a genetic disorder. And you're open to why is this happening? Environmental changes, ozone layer. I remember, again, being taught as a child, we were living in a unique environment. If that environment was not there, we would be bombarded by rays that would affect our immune system, could be cancerous, would certainly not be good for our health. While we fight over global warming, I would say to you clinically, we're seeing the effects already. So currently, they are talking about neuroimmune linkage to Tourette's syndrome. Now, this is very interesting. It turns out, being in Southern California, a Dr. Bob Cummings was like in the forefront of the Tourette's diagnosis recognition. As I later found out, there was essentially nothing called Tourette's before the 1980s. This is part of the phenomena that appeared in that time frame, and for the record, it is all linked to neuroimmune. We have OCDs. Many years ago, the NIH came out with what they called PANDAS, pediatric autoimmune neuropsychiatric disorders associated with strep infections. At the time, I was very encouraged. I told patients, well, this isn't where they have to get to yet, but they were in the right direction. Instead, 7, 8 years later, look at the research. They're fighting. Does PANDAS really exist? Believe me, it does. You have autism, PDD, chronic fatigue syndrome, CFIDs, and again, as I noted, ADHD, ADD, with adults routinely being diagnosed as ADD. Now, people out there will argue, is this really an epidemic? As I presented by the first numbers, I think it's become a very foolish academic debate to try to focus on, is this real or not real? I would respectfully ask all of you, do you really think these children slipped through grade schools, middle school, high school undetected before? We have children out there that were not there before. Now, it's also very interesting to note that what we have in mothers is an increase in miscarriages, infertility, preeclampsia, bleeding during pregnancy. Now, I was taught in medical school these were things that happen, and we had no idea why they happened. Now we know that most of what I presented to you has a huge linkage to autoimmune disorders. So in the past, and again, I'm going to try to bring you back to science multiple times this morning, we do know that there was an association of autism with tuberous sclerosis, PKU, congenital rubella, Down syndrome, Fragile X, but many of you are probably not even told the current discussions. All your children get tested very frequently for Fragile X because someone out there said they might have Fragile X. What it's really turning out is there's no greater incidence of Fragile X with autism. If you have Fragile X, there's a greater incidence of autism, but it's not the other way around. If you look at the children presenting, the children with any of these disorders have not gone up in numbers. Now, what has changed is we are beginning to discuss the genetic and immunologic considerations. Again, I will present literature articles, but I will assure all of you, if you do searches in the literature, you will find multiple articles supporting what I'm presenting today, and I will challenge, again, respectfully, find articles. The next time someone tells you, this is why your children have autism, they better have some scientific reason underneath that to explain their theory. What is appearing in the literature are multiple articles looking at this whole idea of a polygenic inheritance. Again, not one gene, multi-gene, implication of immune system in the pathogenesis, multiple pathways, we'll accept that. We are learning maternal infection may have a bearing. You know, there have been discussions about what might happen in utero, and certainly I have seen children who maybe didn't come out damaged or injured as we might think about in pediatrics, but you knew they had undergone some type of significant stress while in utero. You can show that these are relevant to schizophrenia, autism, and maternal antiviral immune response is mediated by cytokines. Remember that when we come into discussion. I don't want to try to, this is in your handout, so it will be available to you, so don't bother making notes on each piece. But again, there are multiple articles supporting our investigation, our early learning of this idea of the elaborate interactions between the immune and nervous system. So as we enter, let's say, a new era, you come along with multiple theories about what's going on out there. Some doctors have hypothesized metabolic, enzyme, or genetic defect. Although I would say to you respectfully, maybe some rare children really have that. I'll leave open, although it's getting harder to believe it at this point, maybe 1 or 2 children per 10,000 have something that was described years ago. But reality-wise, none of these theories begin to fit or explain the large increase in the number of children diagnosed with autism today. Now, I had to put this up here because I was working, many of you may know, my wife became ill early 1980s. That was my start of going into neuroimmune, autoimmune disorders, trying to figure out, just like you were with your children, what was wrong with my wife. And thankfully, I attended many conferences, many advanced symposiums, NIH meetings, and it led me into the track I'm going. When I entered into the autistic spectrum, 94, 95 range, my wife looked at me first and respectfully said, you know what, you may be crazy. What are you going to do with these children? But it became obvious very quickly that your children are children. It didn't take me very long to realize as a pediatrician that, yeah, they were sick, they were dysfunctional, but they were certainly not the idea of autism as any of us had been taught in medical school. But I want to show you something. In at least the 10, 12 years that I've been active in this field, flavor of the weeks go by routinely, as my wife puts them. I came into this purine metabolism, phenol metabolism. I didn't put up on here, but they were doing facilitated communication. Along comes LOVAS and strict ABA. For many years, they were advocating B6, B12, magnesium. For a while, and coming back again, anticonvulsants. Oh, you children have abnormal EEGs. Let's put them on steroids or anticonvulsants. Maybe we better consider that as pediatricians, we're told you don't want anticonvulsants unless you absolutely need them. They lower a child's IQ. If there's a virus in the brain, putting that child on a steroid is essentially turning that virus loose to do more harm. We went through a phase of vitamin A cod liver oil. Unfortunately, even though the B vitamins are not the answer to this, even though there is danger with anything you megadose in a child, vitamin A has a very narrow level of safe and toxic. We're asking parents to play with fire with their children. Chelation is, of course, big. Secretin got big. And I want you to look, though, because what happens is the flavor of the week comes as the answer to autism. Eventually, when it doesn't work, they go on to the next flavor of the week. And now when they run out of flavors, they're going to recirculate them on you. It's time to change this. Now, many have tried to propose that Mercury is somehow a new disease model. That is what is doing this in your children. Well, again, the next time someone says that to you, start looking at the literature. We have literature that talks about Mercury. This is not an unknown phenomenon. This has been studied for years. And for the record, side point, there is absolutely no support in the literature to say that celiac disease is autism. Your children may have gluten casein sensitivity. I will explain as we go that this is due logically to their allergies, but not to the ideal of celiac disease. We have hundreds of articles on celiac disease, and you will not find one connection in there saying autism. At the same time, we have multiple articles out there on Mercury. Many of you don't know that that was the answer for these poor adults with chronic fatigue syndrome. Everything being said to you about your children today was said to adults with chronic fatigue syndrome. They had this mysterious illness, no one knew what it was, and they got the same reasons. The only thing not done to adults is they did not have secretin given to them. Now, is there any rationale to think that thimerosal, Mercury, has anything to do with autism? I hope by the time I'm done you realize that it cannot. In mercury poisoning, characteristically, you get ataxia, dysarthria, spasticity. You don't see the kind of motor abnormalities that are generally there in autism. You see an entirely different presentation. In autism, you have clumsiness, hypotonia. Now, I'll come back to this because hypotonia, muscle issues, fine motor issues were never part of the autistic literature either, by the way, 20, 30, 40 years ago. We've taken a box and tried to expand what your children are doing But again, I hope by the time I'm done today, you understand that we need to change that box radically. But the key point here is on a medical basis, your children are not presenting with the symptoms of mercury toxicity. They are presenting entirely different. In fact, an appropriate pediatric article, if a child did present with ataxia or dysarthria, they should be given appropriate medical evaluation. Characteristically, in mercury, you see specific bilateral constriction of visual fields. In autism, the defensiveness is believed to be coming from the brain. In mercury, most of your damage is in peripheral nerves. Totally opposite. These children with mercury toxicity, again, I will bring this up as I go along. There is, and I don't know why people think we live in a void. I learned many, many years ago, the Japanese have a tremendous problem with mercury. They eat a lot of fish, okay? They have chronic, they have acute, they have any kind of situation you want to name, and as I will show on a slide later, there is not one word in that literature showing an association with autism. As I have subsequently found out, again, the Scandinavian countries eat a lot of fish. They have a huge problem with mercury. And again, in their literature, there is absolutely no association of autism. Think about this. With what's considered mercury poisoning, this applies, by the way, to many heavy metals. You can substitute most heavy metals out there. You get microcephaly. That means a small head. In most neurotoxins that will affect the brain, you are predisposed to a small head size. In contrast, in autism, if anything, they talk about a large head size. No paper published in peer-reviewed literature has reported an abnormal body burden of mercury, excess of mercury in hair, urine, or stool. What you've got to, again, start to question for the sake of your children. Somebody says to you, this is a new form of mercury toxicity. Well, where's their data? Where's any proof that that applies to your children? When they put studies out there that say, look, we gave these children a chelating agent, and look at the mercury that came out of their body. I'll explain this to you later, but the real literature is already discussing the fact that if I did a stimulation test on probably all of you in the audience, I would get some mercury out of your bodies. We live in a dirty world. But what the PhDs and non-pediatricians out there are forgetting is that nature designed us to protect us. If we have something like that in our body, we keep it in an inert form. It's relatively harmless, and eventually we get rid of it. But when you chelate, you turn that into an active form that is 100 times more toxic to the brain. Substantial literature supports the neurotoxicity of methyl mercury. Relatively little is known, and again, this is what others out there have capitalized. Well, we don't know what ethyl mercury is going to do. But you know what? We do know science and physiology, whereas methyl mercury is actually helped to cross the blood-brain barrier, ethyl mercury doesn't get across the blood-brain barrier very easily. So you have another hole in the idea. How is ethyl mercury doing this to your children's brain? And again, if you go to the literature, it's documented. In exposures to ethyl mercury, you will find higher levels in the blood, much less in the brain. But again, if it's a real exposure, you're going to find it in the blood. It's not hidden. It's not undetectable. It's there. Ethyl mercury exposure has, again, been reported to produce lesions in the spinal cord, skeletal muscle, myocardium. I've yet to see a pathology report on any of your children showing that. And as I said, there have been extensive pathologic studies in Japan. I found out they had contaminations in Iraq. And all of it is inconsistent with what you expect. They showed that you had a proliferation of glia, demyelinization of 9th and 10th cranial nerve. Key point, atrophy of the cerebellar granular cell layers with relative sparing of Purkinje cells. Now, when I, again, first came into the autistic spectrum, I hate that word, the thing I heard was that this had to occur somewhere in the second or third trimester of pregnancy because of Dr. Bauman's autopsy reports showing an absence of Purkinje cells. Now, as I will explain to you, there's a much more logical explanation for what's happening to Purkinje cells, but this is another dramatic piece that says we're talking apples, and I'm even hesitant to say oranges. This is like an entirely, not even related to calling it a fruit or a vegetable. You're out there somewhere in space. Now, as I noted, brains of autistic patients are generally enlarged. You do not see significant cerebral cortical loss in autism. You do see portions of the limbic system with curtailment of involvement. This is important. The limbic system I will come back to. And again, as I noted, the most consistent finding in autism was that idea of the reduction in Purkinje cells. You see an involvement of granule cells, and again, in contrast, mercury causes damage to those granule cell layer. If we're going to have a chance to get the medical community, to get you as parents to really find people ready to change, you're going to have to go at them with logic and with facts. And I'll stress that over and over today. We have parent organizations out there. We have groups out there. Again, when I came into this, I was very sad because the chronic fatigue syndrome world was you guys 15 years ago, 20 years ago. You had desperate patients and no real effective effort to get through to the main system. If we're going to change this, we need to get the people higher up, the people in charge, to listen. But they're not going to listen to people telling them things that make no sense scientifically. They're only going to listen if we present logic and reason to them. By the way, how many of you know mercury was a routine ingredient in many medications in the early 20th century? They had issues of mercury toxicity. Children showed photophobia. Now, I'll come back to that. That is a very significant symptom, and that's probably the only overlap on here that I could tell you some of your children really have. They had anorexia, skin eruptions, and this bright pink color of their hands and feet. It was called pink disease. As important, survivors were not described to have behavioral disorders suggestive of autism. Now, as I alluded to, in Japan, they have tremendous problems with mercury. They've shown low birth rate, microcephaly, cerebral palsy, deafness, blindness, seizures. Again, we can talk about why your children are having seizures in a moment, but you can see here that most of those symptoms have nothing to do with your children. And I might, again, comment, the Japanese, I think, are even finally writing this up, that if you review their literature, they do not indicate that the Japanese clinicians thought there was an association with autism at all. They were following children, adults and children exposed in Iraq, some third world countries, South America, and none of them, again, have had any suggestions of autism. So I want to bring you back to reality. The Canadians, they studied it. One report said maybe there's a little bit of a problem here with speech delay, attention deficit, not autism. Another report said no problem. Again, if there was a problem, you think it would have shown up by now. The two biggest studies on mercury were done. And I forget my pronunciation, the Furrow study and the Sicily study. And these were large enough in number that if there had been any increase in autism, they would have gotten the clue to that increase. Not there at all. So in summary, mercury poisoning and autism do affect the central nervous system. Specific sites of involvement, though, are different. And overall, the clinical picture of mercury poisoning does not in any way mimic autism. Now, what about the vaccination theory, along with the idea that these new theories are causes of autism? And again, I hope you will all respectfully understand that the best thing we could do is lose that word called autism. But what about the idea of vaccinations? They talked about, again, goes back to chronic fatigue syndrome, fibromyalgia, MS. And there is extensive literature, studied, peer-reviewed, that showed there was no association in those adults to vaccinations. What I will say to you, the pediatric literature has now proven over and over and over again, there is no connection to vaccinations. Europe, everyone says, well, geez, you know, you always get reasons why somehow our researchers, somehow the peer-reviewed journals are wrong. Well, I won't tell you I agree with everything that's put out there, but when you have a large body of evidence, then someone better at least come up with some evidence against it before you accept that. I will openly say, yes, vaccines may be a trigger in some of your children. The key is, they're not the focus. If we start to understand, we may have a bunch of predisposed children out there who are set up to go into this dysfunction. And yes, in some of them, the vaccine may trigger them off, but by focusing on mercury, focusing on vaccines, we have avoided focusing on the real problem that your children have. Now, it is our belief, and when I say our belief, this is something that has evolved for me, thankfully, working with a number of researchers over the last 20 years. I had the privilege of working, and I'll bring up work we did with Dr. Mina, Dr. Bruce Miller at Harvard General. They were doing NeuroSPECT scans 10 years ahead of the rest of the world out there. And this was good. For the record, Dr. Mina's database is being used now to help other institutions get started. Our data is extremely solid. But it's very interesting what just happened. I don't know how many of you heard this, but there was apparently a patient sent me a little report coming out of an autism conference in Boston. I believe this was right before July 4th weekend. That report said, oh, we're going to have to reconsider our views of autism since we are seeing a shutting down of tracks on scans. Now, A, I will assume they're referring to NeuroSPECT scans since people have now started doing them. But B, they're discovering what we discovered 10, 12 years ago. The patterns that we see, and I'll go over this at length, are absolutely incompatible with any idea of a generalized brain process hitting your children. There are specific tracks shut down, and when you understand the brain and physiology, the only logical reason for those shutdowns are neuroimmune, and I could argue are viral. This is a 9-year-old girl, quiet ADD. Now, what I'm going to show you is, and again, I won't go into a lot of detail on some of these, the pictures will be available, but what you see consistently is a shutting down of blood flow in what is referred, and this is where the temporal lobes come in. Imagine this is a cut coming up from the bottom of the brain. And this is where they appear. And as I will show you, to be healthy, you're supposed to have red there. And you can see how shut down these are. This is an 8-year-old girl with autism. Well, in this case, more severe, but look at her brain. You have a lot of trouble in that temporal lobe area, plus other areas, obviously. 5-year-old boy with autistic syndrome. 18-year-old boy with ADD NIDS, as we will eventually talk about. Now, most studies out there in research are done with 10 or 20 patients, when in fact we have discussed trials, things we need to do medically. You look at what is going to be statistical significance. And unfortunately, if I had tried to get funded, had tried to get money to do SPECT scans on your children 10 years ago, trust me, there was no way to get that funding. But I was lucky enough, again, to work with researchers. As a private physician, I was able to utilize scans. And our studies, our data, are based on 133, 150 scans and still counting. I'm pretty sure that we are on the right track. Now, let's go back to science and logic. If we're going to win, if we're going to change this, then you've got to go to the literature. While autism has not been associated with those other disorders, there is a strong association of autism with injury to the central nervous system, encephalitis, encephalopathy. And you can find multiple articles. I put something on my webpage, Autism and the Immune Connection, which is what I wrote basically 10 years ago. And you will find ongoing references in there, and new ones since then, that support the idea that, and we learned this years ago, that herpes viruses want to attack that temporal lobe. In the literature, they can show that children that were normal, had encephalitis, had injury to the temporal lobe, became autistic. To show you the correlation, there's even a report in adult literature that an adult, after damage to parts of the temporal lobe, became autistic. Is there any way in the world we can call that a congenital disorder? And this is a 14-year-old boy, had a herpes encephalitis, and afterwards, significant language, social memory deficits, temporal lobe damage. Now, even though I am, again, very, very proud to say the work with Dr. Mina, Dr. Miller led me in this direction, the truth is, and again, thankfully, the literature is supporting the NeuroSPECT work. This was written back in 1995 by Dr. Muntz here at, I believe, University of Alabama. And his statement was they found low blood flow in the temporal parietal lobes. There was an abnormal temporal lobe function that they hypothesized plays a role in the pathogenesis of autism. This was put out there 10 years ago. This was just put out this year, in this case a Japanese study, showing again that they are finding significant hypoperfusion primarily in the temporal lobe region associated with autism. Now, I will say that when you look at the current SPECT scans, and this is the one thing that has changed for me, is our initial technology was not very good at picking up the cerebellum, although as I look back on some of the readings, Dr. Mina was alluding to the cerebellum. Now it's becoming obvious on most of the scans that, again, you have this temporal lobe deficit, you have a cerebellar deficit, and depending upon the extensiveness of the process, you may see involvement of the frontal, parietal, occipital lobes, but the key parts to symptoms are going to be in those temporal lobes and the cerebellum. Now, multiple researchers, again, have reported immune abnormalities. With all due respect, if you leave here with one thought, if someone tells you what's wrong with your child and can't give you some logical, peer-reviewed data why they are telling you it with their new theory, please question it. It's time that parents began to question what they're being told. While researchers are, in a sense, scattered all over the planet on their reports of immune abnormalities, there is no question that there are immune factors going on with your children. And again, if we move ahead with some of the research projects that I plan on being involved in, we will break this immune system down probably 20 times beyond where it is now, and that is where we feel we will be able to define much more specifically the true pathophysiology. But one of the things that shows up on your children, I highlighted, low NK cells. Now, not every one of your children has low NK cells, but I will never forget an NIH meeting I attended in 1992. They were first beginning to discuss, was chronic fatigue syndrome real or make-believe? And as they began to acknowledge that some of these adults did have something wrong with their immune systems, one of the key points was when the NK cells dropped below 4 to 5%, that's when you started to see chronic viral activations going on. And many of your children have NK cells below 4 to 5%. And for the record, when a child is low, it's actually more significant than an adult. So in my opinion, and I think hopefully more people beginning to join this pathway, the true pathophysiology lies in an understanding of the cytokine, combination of what we call cytokines, chemokine. Other influence or factors may play on this immune system, including viruses, maybe a retrovirus, no question a genetically susceptible individual, but for whatever the reasons, you go into this immune-mediated abnormal shutdown of blood flow in the brain and therefore central nervous system function. Now, I joke, I come into this as a clinician. In the world of medicine, thankfully, I am associated with researchers who are way ahead of their own fields. But I'm considered low man on the totem pole, okay? As a clinician, this is the way our medical world goes. But so I try to explain things in what is logical, clinically logical to me. How do all of you feel if you get a cold? You'll be spacey, you'll be zony, you'll be tired. I'm picking on a cold because a cold does not go to your brain. We know that a cold virus cannot go across the blood-brain barrier. So why do you all feel that way? That is a natural defensive mechanism. Our nature designed us pretty intelligently. You're being attacked, invaded by some foreign organism. You actually shut down flow to the brain. You could argue they try to protect your heart. They protect the most vital organisms. But then what happens? 4 or 5 days later, you get well, your brain starts to work again, and that mechanism has opened up on a very simplistic direction. Think of that mechanism as staying closed down chronically, inappropriately, and you have a clue to what's happening in your children. I would respectfully say, and this was again presented at that 1992 NIH meeting, that if the immune system is off, the mitochondria of the cells is off. The mitochondria of the cells are your energy packets. They produce the energy for everything else going on in there. If your cells are not functioning right, you can measure multiple metabolic abnormalities. But again, I would respectfully say, unless we can explain how that abnormality caused the disease, it's secondary, not primary, and you're not going to fix your children, you're not going to fix adults by attacking secondary problems. The primary cause is going to tie into the immune system and open to, again, multiple cellular mitochondrial dysfunctions secondary to that. Now, for me, this goes back, again, many years. In 1994, I presented at what's called the AACFF. This is American Association Chronic Fatigue Syndrome. Now, it may sound a little bit of a strange name, but for the record, it is heavy-duty NIH scientific researchers that were put together to look at chronic fatigue syndrome. I submitted and got to do what was called a poster presentation on NeuroSPECT findings in children with chronic fatigue syndrome. 2 years later, at the next meeting, I presented an assessment of abnormal blood flow in chronic fatigue syndrome versus autism. I made a statement. Those of you out there who are professionals will understand this. In that kind of audience, I said that if you think of this as a neuroimmune-mediated reaction, again, open to whatever the triggers are, if you are an adult with a mature brain, mature immune system, you go into what we have called chronic fatigue syndrome, ADHD, and potentially some other atypical autoimmune disorders. If you're an older child, teenager, you're going to wind up with ADD, ADHD, variations of chronic fatigue syndrome. And if you were a younger child and this happened, you had autism, autistic syndrome, PDD. Now, for the record, in that audience, nobody laughed at me on that statement. 2 years later at the next meeting, many were coming up to me and saying, Mike, you're making a whole lot of sense. Now, I would again respectfully ask you, this was 7, 8, 10 years ago. Why are we not focusing on a major problem for your children? What has become also apparent, you see these family connections. These are things I was never taught about in medical school. You have a mother or father with chronic fatigue or other immune-mediated disorder. You have an older child with ADD or learning disorder. And now you have a younger child or two with autism, PDD. Again, I trained at a good university. We were never told of family situations like this. This is all a new phenomena of the 80s and 90s. I might also make a comment that being in Southern California, Dr. Eric Christian, at that time I think he was at Scripps, this was in the late 80s, early 90s, tried to do a study to find 2 cancer autistics in the same family. I heard and then actually met a fellow who had done this and confirmed they could not find them. They could not find a family with 2 cancer autistics, and now you've got children, you got families out there with 2 or 3 kids. This is an entirely different disorder. Again, NeuroSPECT scan, 5-year-old boy with autistic syndrome, 8-year-old girl with autistic syndrome. The key to this, Dr. Mean and I put an article out on a internet neurology journal, again, peer-reviewed work. Dr. Mean is very progressive as a radiologist and believed, you know, again, in the internet, the usage of communication. And for the record, he has told me this has been the most downloaded article in the last 5 years, period, off of their postings. We made a statement that we believe autism, PDD, ADHD, OCD reflect significant frontal temporal lobe dysfunction. These abnormalities in autism, ADHD, OCD are explainable by the NeuroSPECT. And here is the key. We're supposed to be living in the 21st century. Why are we still doing studies on your children based on 20th century work? Isn't it time we started applying objective markers to determine what is really going on? Now, the truth is, yes, they have started doing that. The fact that that autism conference could allude to scans, but I would respectfully again say, how many more years is it going to take them to reevaluate their opinions? How long can you tell a parent your child has an unfixable, unchangeable disorder when we literally know there's plenty of data out there that says at least a group of your children do not have that? Now, our SPECT scans offer a logical explanation for this progressive process that occurs in that 15, 24-month range. You're looking again at this immune-mediated shutdown, and the dysfunction or lack of blood flow can eventually lead to injury of the cells. I want to bring out, and again, this is one of the most critical things that happen, and forgive me because I do have respect for our medical institutions, what we call the ivory towers, and yet I don't understand. It's almost like because this is coming from fields of psychology, psychiatry, many of you may not know this, but in medical school, my introduction to learning disorders was basically as a pediatrician being told what they were, look for them, and refer them to a psychologist or psychiatrist. It had nothing to do with a medical problem. So on one hand, I will partly defend the medical system and say maybe the people that were looking at this in the beginning weren't trained to recognize the differences. But at this point, one of the key things that has changed on your children, when I came into this, I heard about something called Landau-Kleffner. And believe me, as a pediatrician, I had never heard that term before. I didn't feel so bad when I went up to a couple of excellent pediatric neurologists, and they had never heard that term before. It turns out that Landau-Kleffner was an extremely rare disorder associated with aphasia, abnormal EEGs, and somehow, again, let's make it the popular buzz, well, that's what your children must have to explain their brainwaves. Now, we have a much bigger problem. If it was so rare, and this is literally 10, 12 years ago, we are now talking about 30 to 35% of your children go on to seizure disorders. I would, again, try to respectfully say, this is not a benign encephalopathy. This is not a passive encephalopathy. Whether ongoing damage is occurring because of what we call a vasculitis and immune-mediated irritation to parts of the brain there, or whether, as has become obvious, you have a virus sitting up there in the brain. What's going to happen? You're going to eventually slowly irritate, damage that brain. You're going to get what we are told in medicine, irritable foci, and eventually you get a seizure. This has nothing to do with anything resembling some psychological or unknown disorder called autism. Now, one of the keys to NeuroSPECT is you can quantitate what's going on in the brain. One of my hopes, and I will give you all some good news as we go along, is that with the privilege of working with Dr. Mina, Dr. Miller, they also explained to me that we would have missed some of our findings. We would not have been as accurate if we didn't have what's called xenon. Now, I'll show you a picture in a second, but xenon establishes an absolute calibration for that individual, okay? One of my concerns and hope were that rather than waiting for the system to take another 10, 12 years to get their own calibration, is that we could integrate our existing data, our existing base, and work with other institutions in a much quicker manner. One of the things I'm learning, there are some doctors out there who are going around literally opening up SPECT centers. They never had xenon. I can only tell you their specs are not accurate. The main usage of SPECT is with what's called technetium. And most scanners out there now are based on technetium. We use technetium, it's part of the scan. But without the xenon calibration, you lose a very important part of what helps set up a database. So here is a scan, and the scan on the left, I've shown you this type of scan before, but this blob over here is xenon. But from that, Dr. Mina, Dr. Miller were able to establish critical quantification notes. Now, for the record, most machines now cannot do xenon. We don't need it because we have our baselines established and we can integrate that with our database, but many places will never have that ability and it's going to leave a lot of confusion. This is another child, autistic, and there you see again the xenon scan, but that was again critical for calibration. Now, while many universities are just starting to study scans, I want to show you a little bit of where we've gotten to. We now have the ability, we have such a large database that we can take any given child, impose them on our database, and define what is working or not working compared to normal. This scan has actually been refined. I couldn't quite get it into the computer, but we're actually way beyond this one. Now, when you look at the scans, it shows you, it explains logically what is happening with your children. As I got a whole new education in neurology, left temporal lobe, speech and language, right temporal lobe, social difficulties, cerebella, fine and gross motor, we knew that from medical school. But what you can see here is with the scans, in fact, one of the other things I learned on scan, we talk about OCD. If you have an imbalance between part of your frontal lobe, part of your temporal lobe, you get OCD. So this is technology. I actually question many drug reps coming into my office, why are they still allowed to do trials on neurotropic agents, describe symptoms, and not describe physiology or what's really changing or not changing? And again, this is the level we've gotten to. You can specifically define areas involved, Brodmann areas, other areas. And if we can get together, get researchers to use this information, I believe instead of taking many more years to get answers, we could do this much quicker. So in review, what you see on scans is a decreased blood flow. These are consistent, reproducible. Knock on wood, generally no measurable loss of tissue on MRI. That means these areas are shut down, but not hopefully destroyed or totally damaged. And if this is not brain damage, then in theory, these children started off normal at birth. Now, let's continue with this shift. This is a typical past, when I meet a new patient, yes, I thank you, I spend a long time. Because one is, I have to review the chart appropriately. I do a lot of preparation before meeting the patient. I look at this as pediatrics. The first thing I do is go through the medical records. Is there anything that says a child was injured, stressed, damaged during pregnancy, at birth or delivery, or subsequently afterwards? When you look at the medical history of these children, I want to point out eczema hives. That's allergy. That's not psychological. That's not developmental. That's medical. Frequent ear infections, congestion, stuffiness. Frequent urination can be variable. Some of these children may have just an irritative phenomena. A few can get urinary tract infections. But come back to a word I said earlier, photosensitivity. It has nothing, again, in your children to do with mercury. But photosensitivity, when I was in medical school, was one of the huge red flags. If someone had photosensitivity, they had inflammation of the brain or a viral infection of the brain. How many of you may remember the good old days of measles before we had the vaccines? You had to literally lock a kid away in a room, in a dark room, for 10 days or more because they couldn't tolerate the light. So again, any of your children presenting with a symptom of photosensitivity deserves a medical evaluation. Look at these other factors: sensory processing, vestibular dysfunction, auditory processing. Now, yeah, we can just assume, oh, this child's defective and they can't do any of those things. But the truth is, since most of them start off healthy, when these type of functions go wrong, there is going to be a medical reason for that. Abnormal EEGs or seizures, as I commented to you, this had nothing to do with the field of autism before. I had to smile because on a new patient the other day, she goes, convulsions maybe. I mean, many of you come in with that kind of statement. You're not sure. Your kids tune out, they dull out. Well, again, thankfully, most of them do not have true seizures, but we've got a problem affecting their brain. Now, I came into this as a pediatrician. I remember, date myself over all of you, that when we were growing up, the joke was, you woke up in the morning, you conked out at night, and you kept burning the candle both ends all day. Teenagers did that. I would respectfully again say, how many teenagers can't do that nowadays? And how many of your children are fatigued, are tired? This is a significant medical symptom. Has nothing to do with that A word, whatever we want to call it, but it is a medical problem. One of my early lessons on children, again, started with ADHD, chronic fatigue, now autism. You wake up tired in the morning. Do you know why? It's been documented in studies that on adults and on some of those teenagers, they do not go into a normal stage 4 REM sleep cycle. So one of the things I look for in using, and I'll come into it, medications or treatment for your children, if I can get a child waking up bright, alert in the morning, short of a SPECT scan, that's a pretty good sign that the brain is close to where it ought to be. For the record, the brain consolidates memories, does housekeeping while we sleep. There's a lot of reasons why those sleep cycles are critical. Tuned out, we can argue whether a kid's trying to ignore things or they are somewhat spacey. OCD, we now know the immune connection to that. And again, finally, fine and gross motor abnormalities. Any child, I would again respectfully say, any child with fine or gross motor abnormalities should be immediately taken out of that basket we call autism. Now, I keep saying, and it has been very frustrating, because I really believe that a lot of researchers, a lot of good people, are forgetting what we were taught. Part of it may be that the wrong people are looking at your children. I hope that this will lead to other professions getting involved as they should. But again, I'm going to bring you back to facts. What is a disease? Something is wrong with bodily function. A morbid entity characterized by at least two of these criteria. Recognized etiological agents. I would say to you with no question, we have an association of herpes viruses and potentially other viral infections. An identifiable group of signs and symptoms. In this case, we know the signs and symptoms of autism. We certainly believe we can set up very objective criteria for immune and other markers. By the way, I will bring this out. This is one of your biggest problems. You've noticed how autism is DSM-4 category? You're all familiar with that? Please take a look. DSM-4 is the psychological literature. It is not considered a medical ICD-9 diagnosis. And finally, we have consistent anatomical alterations verifiable on NeuroSPECT. So I bring you back to that critical statement. Science says an epidemic cannot be developmental or genetic. It is scientifically impossible. One must have a disease process at work. And I would respectfully say the only possible cause for it at this point is immune or viral. Now, again, I'm hoping that when you leave here, I will have presented enough data that you will all start to question what is going on out there. And where, again, I do not believe you will find any article in the literature linking many or most of the ideas you have been told cause autism in your children. What you can find are many pertinent articles that start to explain this. They did a study, again, this goes back on chronic fatigue syndrome patients, immune activation. Again, it starts from the adults. They looked at HHV6, HHV7, HHV8, persistent reactivation. Now, let me stress another factor. Date myself again. In medical school, we learned about herpes viruses. Herpes 1, cold sores. Herpes 2, vaginal. If one of those viruses goes to your brain, you are essentially going to be comatose, in a hospital, and literally would live or die in a very short amount of time. We knew of roseola, of course, in children, but didn't know the virus that caused roseola. Okay, and I was at a very good medical school. A few years later, we learned, oh, HHV6 causes roseola. What we now know is there's a whole family of herpes-related viruses, HHV6, V7, V8, there may be a 9 and a 10. We're very creative in medicine in naming things. But these viruses behave very differently. They go to the brain, and they hide themselves from your immune system. I actually have children that will come in, and because of clinical suspicions, I will put them on an antiviral. Their initial blood work did not necessarily say they had a virus, and on repeat testing, a titer like HHV6 that was negative to start with is now high. It's actually very logical why that happens, because when you attack that virus, you now make it vulnerable to the immune system. That virus was there to start with. But now you've given that body and that immune system a chance to attack it. Now there's another problem with all this. These are much smarter viruses. I talked to you about herpes 1, herpes 2. They go to the brain. You're going to live or die very quickly. Well, think about it. If you kill off your host, you kill yourself. These viruses are much smarter. We'll live off the brain, we'll stay low grade, and we can keep living and we leave the host alive. Somehow, though, I don't quite think that's acceptable that we may have a lot of children and adults out there with viruses living in their brain, and we need to stop this. As I said, there are multiple articles supporting the concept of these viruses. They know that you can have active, persistent infection with HHV6. I'll say everything I say HHV6, you could say 7 or 8 right now. Highly neuroinvasive. Again, this has been studied in adults. Why isn't it being studied in your children? We know these viruses want to go to the brain. This is an example on roseola, and again, we're slowly in pediatrics coming around. Treatment may be considered for patients with serious HHV6 or HHV7 associated disease. Well, you know what? I consider an autism, or whatever we want to call this, quite serious. This is a girl, normal, by the way, at birth, 14 months old, developed fever, floppiness, encephalitis, carditis. By the way, when I talk about the dangers of steroids, if there's a and this, by the way, may apply to vitamins and supplements too. If there's a virus in the body, when you give steroids, you are lowering your immune system. You are turning that virus loose. The other favorite target for these viruses beside the brain is the heart. Okay, those are the two key points. Likewise, when you feed nutrients to people, when everyone says, oh, here, take these supplements, help your children. Well, I'm a doctor who is not opposed to nutrition. In fact, to this day, I am very thankful that in my training, I had an allergist, immunologist, that taught me to think of food elimination with children. In doing that, you begin to realize that there is a role for stress on the immune system. You began to realize that things play a part, but discovered something. I was trying to help my wife as desperately as all of you are trying to help your children. I looked at a company working with prescription grade vitamins, amino acids, in theory doing as accurate a process as you could do, and that was doing an amino acid profile, specifically mixing a combination for them, again, not megadosing people, and what I learned from that has served me well to this day. If I cleaned up the body, taking away triggers, gave them things meant to help them, I might help them, but I wasn't going to cure them. I wasn't going to get them all the way better. But I also learned a very big negative. If you look at the amino acids, the ideal is that lysine and arginine are the markers for your immune system, okay? Now, learned real fast, I could give somebody lysine, and it might help them, didn't usually hurt them. I gave them arginine, which, by the way, is in peanuts. Many of those patients did much worse. Do you know why? Arginine feeds these viruses. Who are we to say that when the body is low in something, it's not doing that to protect your children? We need to get the proper studies, the proper information out there. A lot of mistakes can be made by just saying give your children supplements or nutrients that may not be helping them and may very well be helping the disease process. And this, again, is a child who we know the effects of HHV6. She didn't turn positive, by the way, on blood work till 14 days later, but she went on to convulsions and lost her social contact, ability to walk and sit. Oops, hold on, sorry. There we go, okay. Now, this was a very interesting study. I want to try again. We have hopefully enough time to cover things today. And some of the evolution for me over the years is now going to play a role in what may help your children. A very interesting phenomenon. They started looking, of course, at HHV6. They found that titers were significantly higher in non-pregnant versus pregnant women. Anyone have an idea why? Okay, again, nature is logical. A mother with I learned real fast, a mother with chronic fatigue syndrome would go into a pregnancy and start to feel healthy, feel better. She might relapse 6 to 8 months after the pregnancy, but nature was helping her. Ultimately, the way we're going to help your children will tie into that phenomenon. I'll explain that down the line. But the key here is that what they really showed was that these titers were higher in non-pregnant women, and it's, again, just touches on the fact of what's going on with our immune systems, what's going on in the community. They also discovered, this is a virus that's all around us. They've had cases now from transplants where they have passed on HHV6. And again, look at what it does. It's a neurotropic virus. Mental status problems, confusion, coma, seizures, headaches. Now, I want to show you again how things keep changing. We always made a joke, of course, that what is the real role of stress? Again, coming into this from the chronic fatigue syndrome world, there was the concept of the yuppie flu. Once they decided these adults did not have Epstein-Barr, they must all have the yuppie flu. That was one of the huge mistakes we made along the way. But what we have found now, and this gets very interesting to how the brain develops, the physiology of the brain. If a woman was abused in childhood, okay, you find as an adult increased pituitary adrenal autonomic responses to stress, a 6-fold greater ACTH response to stress. So this says that maybe there is a connection between what we undergo in stresses and development and how our brain works, but it's physiologic, not mental. Now, there are, again, multiple articles out there showing autistic regression located to seizure activity. I will merely point out, take a look, central temporal area. That's where the herpes-related viruses like to go. Conclusion, clinical difference likely reflects the location of the epileptiform activity, central temporal, anterior mid-temporal. Now, there have been more and more discussions about serotonin. And as I will explain to you, yes, I do use SSRIs with these children. SSRIs are serotonin reuptake inhibitors. I will not use what we call the complex ones with your children. I will use the simple ones, which are Paxil, Prozac, Zoloft, and Celexa. For your information, I don't know how many of you are aware of this. One of the only medical reports out there showing improved brains on your children was by a Dr. DeLong, who showed Prozac, to his surprise, the children's brains were healthier. Now, everyone tells you they're doing all these things to help your children, and I'll be the first one to agree with some of the people against it, that to give your children drugs like Abilify, Risperidol, heavy-duty antipsychotics is not helping their brain. It's merely suppressing their behavior. But if we do things right, and I will try to lead you to why I believe this is right, only usage of a medication should be one goal. Can you help your children's brains work and function as they should? I am a pediatrician. I tell every parent, I'm not a psychiatrist, I'm not a neurologist, and I will never give them something to control their child's brain. But interesting, in the literature, you see support for the idea that they actually relieve some of the symptoms of autism with selective serotonin reuptake inhibitors. As I said, Dr. DeLong published an article many years ago showing that. Now, a couple of parents have asked me, because some of this work shows that you may metabolize SSRIs differently. And many parents will say, well, how do you know, my child's okay? I don't ever use a standard dose of a medicine on your children. I have ideas where I expect to get to, but in working with a child, you work from the bottom up. So it isn't going to matter whether they metabolize it faster or slower, I'm going to reach an equilibrium for them that is hopefully right for them. But again, the literature is showing how serotonin is going to play a role in this. And there's now more and more discussion about viral etiologies. And what they are questioning is whether a viral infection, again, during the pregnancy, may leave you with a problem, damage to the central nervous system, alteration of the immune response of the mother or offspring. Now, one of the things I will say, and this is a very fine line, yes, we know that many mothers with this have autoimmune disorders, and there is certainly a high probability that some of them may be carrying viruses. Now, interestingly, I have patients all over the world. I have had patients in Southern California where I had been treating the mother for chronic fatigue syndrome, knew I was concerned about background viral activity, had the OB leave the mother on Zovirax. Zovirax is an old anti-herpes med that at this point we look at as very safe. We can give it to prematures, we can give it to neonates, and the OB left the mother on those meds, and each of those mothers has had a healthy, successful pregnancy. Sadly, I have a mother in Israel, her OB would not leave her on an antiviral, and she has had 2 miscarriages. Now, again, these are things that need to be studied. They're studying the wrong thing on your children. Let's get to reality. Let's see what's really happening. But I want to make a strong point here. I do not believe in any way that you, as mothers, are giving your children these infections. Okay, these children are generally not born like they've had a viral infection. Again, remember what I said, I go back and review the history, I review the delivery, the pregnancy. I could give a lot of cases where I know the mother had a stress pregnancy, had a tough time, was not herself well. And as I'll tell that parent, in the, let's call it now, old days of pediatrics, we would look at the baby born and say, your child is fine, everything is okay. Well, that might have been the start of the stress on this neuroimmune system, but that certainly was in no way caused by that mother. We know from animal models that early viral infections can create behavioral changes later in life. There's evidence out there right now, both for and against the association of autism with viral infections. But again, I'll say there's evidence out there. There is no peer-reviewed evidence to support 90% plus of what you guys have been told about autism. And as I noted, the best association to date has been the idea of congenital rubella. Now, if that hits the mother during pregnancy, we know that's going to injure the mother, injure the baby, and one of the side effects of that may be autism. Now, there's another study here, and I'm going to skip over some of this quickly for you guys, but this is another study that showed a response to fluvoxamine, which, by the way, is Prozac. It is very frustrating when I see so many parents subscribe to autism letters that on purely anecdotal incidences report how this therapy helped and that therapy helped, and basically most of the time says the drugs are terrible. And yet, again, if I can bring you back to the literature, ironically, in the literature, one of the only therapies that's shown success for your children is SSRI. Again, another article showing invasion of the central nervous system by HHV6, HHV7. There is, again, no debate anymore that these viruses go to the brain, but as I will show you when we look at the autistic literature, who's studying that on your children? Now, how many of you have seen or are aware of this article? Very, very few show of hands. How many of you know that this was released in December on the internet, published in January '05 out of Johns Hopkins. Now, let's face it, I can make jokes East Coast, West Coast, but Johns Hopkins is a very good medical school, very good scientists. And this, I'm going to illustrate to all of you. What you've got here is researchers looking at your children's brains. Many other articles out there are assumptions, they're associations, they're ideas. These people, to tell you how good this study is, many of you who know me know that I've been writing about trying to get the doors to open for your children to new type of agents that could dramatically change the whole idea of therapy. As much as the researchers I've worked with have begun to believe me, they now say, hey, maybe we should have listened to you a few years ago, you still have to get to the FDA, to the NIH, if you're going to do appropriate trials. To tell you how important this article is, once it appeared, the researchers I'm working with are ready to go to the FDA for your children. Why weren't most of you told about this? Isn't it time enough parents started to question? And what does this article say? They set off to investigate. Unfortunately, that's the one problem I will come up with academics. We have created a system that will investigate and study, but doesn't have to come up with answers. When it comes to your children, we need to demand faster studies and answers. In this case, they said, we want to look at the immune-mediated mechanisms in the pathogenesis of autism. They did very appropriately controlled, sophisticated measurements to look at these factors. They demonstrated an active neuroimmune inflammatory process in the cerebral cortex, white matter, and cerebellum. Now, forgive me, the day this article appeared, how can any expert in autism with a straight face say your children have an unfixable, unchangeable, unknown disorder? This should have made every academic person out there at least start to question what they are saying. This indicated, Okay. This suggests a defect in neuronal maturation may be responsible for some of the neurological problems in autism. Immune dysfunction, of course, has been proposed. Several studies in they support that what we know already, that studies in peripheral blood have shown abnormalities. They raise the issue of maternal antibodies. But as they note, there have been no studies before linking the findings in the peripheral blood to the brain. Now, again, I believe with researchers I'm involved with, we are all set to do that and can do very sophisticated studies, but this was a great study, okay? So they decided to look at this, and what they did is they looked at tissue. You know, there are, unfortunately, and the way we do things in medicine is these are children who passed away for unrelated causes, a drowning, an automobile accident, something that was not directly tied into their supposed process. And what they found was a myoglial response in autism, diffusely distributed in the cortex subcortical areas. And get ready for this. These responses in autism resemble those seen in neurodegenerative disorders such as Alzheimer's, Parkinson's, amyotrophic lateral sclerosis, and are similar to the dementia seen with HIV. Now, I'm working with researchers who are ready to start agents for trials with those disorders, agents that have never been out there before that may entirely change how the immune system responds. I'll talk about that a little later. This article alone says your children are not what was described 40 years ago. Now, they showed marked activation, as I said. Now, this is why this was not broadcast all over the internet. We live in a free country. Somewhere growing up, I was taught about yellow journalism. But I have never seen so many bright, intelligent parents misled and literally information controlled on what you're allowed to see. Part of the summary from the authors in this article was that this indicated an innate neuroimmune reaction playing a role. Now, why is that important? That means it's internally triggered. It eliminates all the discussion at that point of these external ideas. A lot of people don't want you to hear that. So, what does this all mean? Let me ask Kay, is there a point when we want to give people a slight break? I can keep talking.
That would be good just as soon.
Pardon?
That would be good just as soon as you could make a break here.
Just whatever people want.
That would be fine, just as soon as you finish up.
Okay, let's take this and then I'll go into a break. Now, this is the key. I think I've hopefully laid a foundation with all of you and those who may hear this presentation that we are looking at a disease, not a developmental disorder, not a congenitally miswired brain, but a disease. And if this is a disease, that means these children were born with normally functioning brains. In theory, that means they can be fixed. You cannot fix or recover from a developmental disorder. You can recover from a disease. And as time unfolds, this has tremendous implications. We now know that the brain is pliable up to at least 19, 20 years old, maybe further. The old ideas that a brain stopped at 5 years old or 10 years old are gone. So while it's never as easy, while it's a bigger challenge, older kids can also be helped. There's help. As I will talk to you about, I have thankfully seen wonderful changes with many older children. The key is to make that shift, and I'm learning harder than I could ever tell you, that to get this system to switch from looking at a developmental disorder to a disease has been the hardest switch to pull that I could ever imagine, but it's time we all made that switch change. Let's take a little break. In the past, if you look at the idea of an autistic child, they were trainable, you tried to make them cooperate. No focus was on improving cognition and processing. Perhaps the only point you will find me agreeing with many of the alternative medicine doctors out there is I also think it is barbaric to give your children risperidol, as I said, Abilify. If you look at the universities, they have done multi-center trials on these kind of agents. And what is the purpose? Well, if your child started with autism and they can't be fixed and they can't be helped, well, let's control their behavior. But if you understand, and I'm going to bring you back to this, I hope time after time, that this is a disease, then I start from a position as a pediatrician. I will not give a child anything that I would not give to a healthy, regular child. I may have to treat this illness. I'm going to use medications to deal with it, but I will not use a medication that I have to worry is going to damage your child, and I'm not going to do anything that goes against basic pediatrics in supporting a child. Now, according to, again, the past, an autistic child is not supposed to be able to recover, develop functions. You try to compensate. Many of you are professionals out there. What have you been taught your whole careers? You try to help the child as much as you can, but it's almost like we've created a lovely paradox out there. We want you to do the best you can, but we don't expect you to really be doing anything. Does that make a lot of sense? We're running into a special ed system that is supposed to help take care of your children, and yet as resources become more and more limited, how can they devote resources when they don't believe they can help your children? So I hope that one of the goals from this is if we can get the educational system, the therapy system, to believe in your children, then you're going to get an entire different level of priority there. And with that, we need to make a very dramatic shift. Instead of thinking about training, cooperative, behavior, we need to start understanding that these are children and we have to help them rehabilitate from a serious illness. Now, this is Wayne. Wayne came into the family with trouble talking, was kind of spacey. We subsequently found out it was probably exposure to my daughter's perfume, but we figured we had problems with Wayne. So I got his permission to say what a therapist recommended. When presented with a novel task, Wayne will avert his gaze and attention and perseveravely manipulate the item presented rather than engage in purposeful exploration. Each new step in play must be taught. It is felt that Wayne would benefit from an intensive educational program that includes one-to-one instruction of repetitive drills and structured play, as well as services to address areas of receptive, expressive, fine motor, gross motor, and sensory processing. Now, obviously, and I hope you all know this, I take what is happening to your children very seriously. But the reality is, when I get a new patient and I read a therapist's recommendation like that for your children, it has become outlandish to me. Now, unlike the old ideas, instead of saying, well, if a kid hasn't talked by 5 or 6, they're not going to talk, I can give you routinely children who are now 10, 14, 18 years old and have not only responded to therapies showing they are intelligent, having a chance to learn, but many of these older kids have been able to develop language. I have a little boy, and part of the problem, by the way, is the orientation of therapists. And please understand, any frustration you hear from me, any anger, is not at you guys. You're here to try to help your children. It's not at the parents out there, but it is really at a system that has blindly written off these children without asking the big question anymore, which is why. I have a child, to give you an example of what therapy means. I have a child that started with me back east. Came to me, typical, I hate the word, autistic. After a couple years, he was doing so well that he would type things out to me. He could not say a word, okay? Now, I've tried to encourage this mother, and if she does, I'll recommend it to all of you to put a book out from this kid. If no one out there understands what these children are really thinking. This boy was misbehaving, giving people a hard time in class, and I was due to see him in a few days, so I said, "I'll wait, I'll talk to you when I get there." And meantime, the mother says, "You know, what's going on?" He types out, "I'm tired of being treated stupid. I want to be in a better class. I want to learn." Now, how many of you think of your children that way? And you know what happened? When I met him that visit, I said, "Stephen, you need to behave yourself. You need to work hard. You need to show them that you're a good kid." And this kid subsequently wound up in regular 4th, 5th grade classes in New Jersey, still could not say a word, had a nicest phone call I can tell you with the mother. This was about Christmas vacation. The child was 13 and a half, almost 14, and has begun to talk up a storm. You guys know why? Beside being on medication, again, I treated him all the way along, they moved from New Jersey to Washington State. In Washington State, he was no longer under the autistic system. As the mother joked with me, he's being gang tackled by a speech and neuromotor pathologist who won't take no for an answer. And this is really the difference. We send all of you out there as professionals being told what these children can never do. Now, I will agree, by the way, unfortunately, if a kid is off in space, not treated, not helped, can't respond, yeah, you're not going to have the same child to work with that I'd like you to have. But if we start to focus on the disease and you start looking at what level is this kid, if you're going to get a kid to talk, we have to go back to the skills of rebuilding oral motor skills. Again, I will illustrate to show you how bad this is. I had a new mother about a couple years ago. Her child's doing very well right now, by the way. Comes in, she is an oral motor speech and language pathologist. In her note to me, she goes, but my kid's not like other children I've worked with autism. So of course my first statement was, that's because your child doesn't have autism as that word is used. Now I'm going to use this because it was a very interesting discussion. I said to her, what are we taught as professionals about children? One of the early lessons as a pediatrician for her as a speech and language pathologist is if any child has serious illness, serious disruption of their learning processes, the first 12, 24 months of life, they are going to have language problems, they're going to have auditory processing issues, they're going to have learning issues, okay? Then I looked at her and said, what were we taught to do about it? Unfortunately, being from Hollywood, I'm no great actor, but she looks at me with kind of like a, and I said to her, remember, you have to rebuild that child. You have to rebuild their 6-month, their 8-month, their 10-month, their 12-month, their 15-month, their 18-month, their 2-year-old skills. Now, to show you how bad that A word is, this mother looks at me and goes, I never thought of that before. This is what we have done with that A word. We've taken all of your training, all of your beliefs, and made you throw them aside to do something that isn't going to really, in the end, work with these children. So with the realization that these are children, it also guides you into how to deal with the child. If you have an 8-year-old kid and they're acting like a 2-year-old, instead of assuming that child is lower intelligence, started off with a developmental disorder, please start to realize, even untreated, I don't think any kid has a fair chance not being helped and not being treated, but even untreated, many of these children are bright kids. If you will go back to where they are, if it's a 2-year-old kid, you deal with that 2-year-old kid. If it's a 4-year-old kid, you deal with that 4-year-old child. As a pediatrician, I cringe. I've spent my whole life trying to help parents raise healthy children, be good parents, and I cannot remember once giving a parent advice, well, if they misbehave, refocus them, redirect them. No,